Welcome to Learning and Teaching Systemic Therapy podcast, the official Society for the Teaching of Marriage and Family Therapy, STMFT in short, podcast. I'm your host, Dr. Sofia Georgiadou. I created STMFT and this podcast as an antidote to the isolation I experienced as an early career academic, as a space to allow myself and my colleagues to share resources and bridge the way we do systemic therapy with the way we teach systemic therapy in our classrooms. Today's episode is especially exciting for me. We're going international. I'm honored to welcome our very first guest from Australia, Dr. Kate Owen. She's a psychologist and clinical family therapist based in Australia. She runs a private practice supporting individuals, couples, and families and provides clinical supervision to practitioners and both government and non-government mental health and counseling teams. With a passion for integrative systemic psychotherapy, Kate delivers professional development training across Australia, offering workshops on foundational and advanced family therapy skills, trauma-informed practice, and self-care for helping professionals. She consults to hospital and health districts to support the integration of systemic thinking and practice into public mental health services. Kate has presented at both national and international conferences and co-authored a publication on systemic integrative practice in the Australian and New Zealand Journal of Family Therapy. She has previously run an accredited family therapy training company that supported professionals in gaining their qualifications as clinical family therapists and has taught in university settings. Kate is committed to supporting the next generation of clinicians through engaging, reflective, and practice-based learning. In addition to her in-person work, she creates online courses and practical resources designed to help professionals deepen their skills and confidence in systemic and trauma-informed practice. She's also the creator of the Keep Calm cards, along with a range of other tools developed to support clinical application and reflective practice. So we'll explore in this episode what it means to teach systemic therapy in ways that are culturally responsive, emotionally grounded, and brain informed. So I hope this conversation will leave you thinking, feeling, and teaching differently. Without further ado, let's dive into our first question. Welcome, Kate.
Hi, thank you for having me, Sophia.
Yeah, I'm so excited you're here. The first question we're going to go through today is about your workshops. And I know you have a very experiential, interactive teaching style. And from the resources I have seen on your site, you make very complex concepts easy to grasp. So I'd love for you to speak to any specific classroom modalities you rely on to achieve this more experiential way of learning. Do you use role plays, video demos, small group exercises, live demonstrations? Can you talk a little bit about how you help your learners link systemic theory to clinical practice in your courses?
Yeah, thank you. So, linking theory to practice is really important to me as an educator because I want practitioners to walk away from whether it's a 1-day workshop, 2-day workshop, or a 2-year program, not just understanding the theory, but feeling like they can use a question, use a skill the very next day and understanding why they're using it. And so when I am teaching, I really am looking for opportunities for those multiple entry points for learning. So whether it's visual, experiential, or reflective, because everybody learns differently. Just like when we're working with families, they all have different assimilating information. So I want to make space for that in my learning environment. So my guiding principle before I go into maybe the specific modalities is I always want to model the model when I'm teaching. So the process of being in the learning environment is just as important to me as the content. So I'm always looking to create a felt experience of what it's like to engage with the systemic practitioner. And so I'm really mindful about how do I host people in the room? How are they invited to engage in the learning process? How are they invited to engage with each other in the room? How can I amplify the strengths of the people in the room? And how do I create those opportunities for news of difference in their learning journey? So that's my guiding principle overall. And then if I
Love it.
had a shopping list, of experiential modalities, then it's a pretty long list. So please just stop me if I just talk, because I could talk about this for a long time.
I love it.
But first of all, yes. So role plays and skill practice. Sometimes they're structured. So I will provide like a clear character vignette or a scenario. And then other times it's an unstructured role play because it depends on the group's confidence level and what am I aiming for in that teaching section. And I'm also happy to demonstrate live. So just even yesterday, I was in a workshop and one of the participants said, "Hey, Kate, but how do you do that? What does that even look like?" And so again, I'm modeling the model. I'll jump in and we'll do a spontaneous live demonstration or I'll role play together. And I'll role play the therapist. I'll ask if they would like to role play the scenario that they're feeling stuck in. And then that way people can see the work in action, because I think it makes a difference in terms of
Yeah.
learning a concept, but then seeing it put into practice.
Mm.
But alternatively, if someone says, "Oh, how do we do that?" And what I want to do is get the group to practice as opposed to me demonstrating, then we could do a therapist hot seat activity. So this is where the
Mm.
trainees, they tag team in as the therapist and they take turns responding to the scenario, and they can build off each other's questions or interventions. And it's a playful way of practicing because everybody knows that they can stumble, that they can call a timeout, that they can tag team out and go, "I'm stuck, someone else jump in." So I like that as a possibility as well. When I'm teaching a new style of questioning, then one of the options I have is to provide a scripted interview. So then people will break off into pairs and one person will be the interviewer and they'll be following along the questions, and one person will be the interviewee and be having the experience. So for example, when I'm teaching narrative therapy and I'm trying to teach the skill of externalization, then they have the script of common externalizing questions. And that's not for them to then take that script and that's the prescription for when they use it with the client, but it does provide an opportunity to rehearse and build their confidence before they have to improvise themselves. And then when we unpack that activity afterwards, then we're reflecting on what was happening for you as the interviewer. How did you feel asking those questions? Did it feel comfortable, uncomfortable, etc.? But then we also get to look from the perspective of the interviewee. What was your experience of being asked these externalizing questions? So we've got multiple layers of learning that's
Perspectives.
going
Yeah.
on. Yeah.
Mhm.
And
In the
then,
scripted, can I
yes,
ask something quickly about the scripted
yes,
interview?
please. Yes.
So when you have them practice, can they add other follow-up questions to that scripted interview, or they have to go through the scripted interview and just see how it feels, play it out?
So that's an excellent question. And that is also part of when we process the process, because
Okay.
some people want the comfort of following the script. And then other people, they get so curious and they want to go off into different directions, etc.
Mhm.
And so then we get an opportunity to process those follow-up questions that you were asking. Was that from the narrative perspective, or did you find yourself asking questions coming from a different school?
Mm.
And so then that also helps people to reflect on their own preferences for which models that they're drawn to. So yeah, they could do whatever they like, and it's in the processing that
Okay.
we then understand it. Yeah.
I see. So you give them choices and then they go off from there and then you process, you come back and you reflect together what happened during this
Yeah.
exercise, right? Mm.
Yes.
I love this. Okay. Yes, you wanted to say more, so I don't want to stop you.
Yes. I have a big shopping list of ideas here.
I love it.
So the other things that I like to use for the experiential component is watching video clips And so we'll be watching Mnuchin, we'll be watching Virginia Satir doing a parts party, or we'll be watching Michael White. And then the group are unpacking, oh, what is it that they're doing right now? Why do you think they're doing that? What's the effect on the family? And then I'm always encouraging the trainees, and how would you do it differently? Because I want them to have their own style, not to be carbon copies of the iconic masters. And
Yeah.
then,
Do people do
yeah,
that readily though? Because it's hard to say, oh, I would do this differently compared to Michael White. I would be intimidated to say, this is how I would do it differently.
that's a good point. Although I have to say, yeah, I do have the trainees who would say, oh, I wouldn't say it like that. Or they might say, oh my goodness, what about this? So I think that comes down to, again, the guiding principle of the felt experience in the room. If I've created the relational safety where people can have a different point of view and are welcoming multiple perspectives, then the trainees do have that confidence to be able to have a different point of view.
They come in with a lot of opinions, then I'm sure they come in with all the kinds of different perspectives and things.
Yes.
I love this. And how, when you're watching a video, that I'm sure that depends on the occasion and the training, but I'm wondering how often do you hit pause on a video like this with a master doing their
Yeah.
thing?
Fantastic. So targeted snippets. So I will select specific pieces of the video to highlight a particular section of the teaching. And then so we might play multiple snippets across the teaching section so that we can be able to, yeah, link more clearly the theory to practice.
Okay, I love this. Before we go on to more of your shopping list, I want to ask about this guiding principle and the idea of creating relational safety in a room where a bunch of people will likely meet maybe once. Maybe some of them known each other through like common circles, professional circles, but this is a unique classroom, like a one-time classroom that you create when you offer a workshop. So can you talk a little bit more about what you do that creates this sense of relational safety? Maybe some things that happen before even the workshop starts?
Yes, absolutely. So because I want to model the model, then very practically, what I will do is if it's a 1 day workshop, I will greet every person as they come through the door. And I'm very mindful of my posture in terms of how I greet them warmly with a smile to make them feel comfortable as they're coming into the space. I also tend to be known for giving out regulation gifts. So I have these little sensory rings. And so I gift everybody, usually in the workshop, a regulation tool so that they have something that will help them to be grounded throughout the training. And then, even though it takes time away from the content, I make the space for, in that introductory section, to have the people introduce themselves, either all, like we'll go all the way around the group, or just in their tables, because I'm going to be asking them to be doing role plays and reflecting. And people don't really want to jump into doing that if they don't have a sense of who's this person next to me? Are they judging me? And I like to model the model. So before I get people to do those introductions, I will do an introduction that is about who I am, but also brings myself into the room as well, so that I'm connecting with people in a way that is in line with my way of being, so my humanity. And so that then helps people to go, oh, okay, so this is a learning environment where we can bring ourselves into the room. We don't have to be experts and just have our professional hats on. We can be human here too. So they're just a
I
few
love
ideas.
this. Yeah, I love this. I feel like this is what I'm doing in the beginning of this podcast when I talk about like why I created the podcast. I
Yes.
don't know why. I mean, I've done a few episodes already, so I'm like, oh, maybe it's not necessary anymore. Like people know why I created this podcast, but I feel like I need to say it every time. It's almost like a tradition at this point. to say
I
it.
love that. Can I add as well, what I noticed when we got online just briefly before we started recording was I could sense yourself, so your warm smile, the energy that you were bringing, your excitement, and we had that little bit of a connection before we jumped in. And for me, that was creating the relational safety for us to
Mhm.
go into this conversation.
Yeah, you're so right about that. These are the little things that we don't even notice. But now that you said it, I'm like connecting the dots right now as we speak.
Well, I think
That's
this
so
is what we
fascinating.
do. This is what we do as therapists. We are really mindful of all of these dynamics. And that's what I hope your listeners will take away is that take that skill set and apply it to your teaching room because there's power in that as modeling the model, but also giving people an experience.
Yeah, yeah, absolutely. Yeah. Okay, I want to move on to the next question just so because I feel like I can be here with you for like 3 hours and I know you don't have 3 hours.
Okay, all right. I will abandon my shopping list and we will continue.
But I want to say we can add some resources if you want in the show notes. We can add some more ideas for people to consider if you are open to it. We can certainly let people know. These are some of the things that we didn't get to touch on
Yeah, no
during our
problem.
conversation. Yeah. So my next question is about using metaphors or stories in your workshops. And could you give us an example of how you use metaphors and stories to deepen understanding and learning?
Yes. So I think that metaphors and stories help bring systemic ideas to life because they give people something to connect with. So whether it is like a picture in their mind or a feeling, but it's relatable. So it's making these abstract systemic concepts feel, oh, yes, okay, that happens in my everyday life. So I can make that connection. So, an example that I'll give is when I'm teaching the evolution of family therapy in the Australian context. So, we've got our first generation schools, the second generation schools, and we're in a third wave, which is contemporary practice in Australia is an integrative approach. So, we're weaving models across the different generations, but we're also weaving in across disciplines like neuroscience. So, the metaphor that I use to teach that is I talk about therapists being a chef in a well-stocked kitchen. And the therapist, who is the chef, they go into their pantry and they have their platter that they have to take the ingredients off the shelf to decide what am I going to offer this unique family sitting at the table. And so they might have a shelf with all their first generation ingredients sitting there, and they might say, yes, that's going to be useful. Let me take that. They might have their second generation shelf and go, oh, yes, I have to take a piece of that as well. That's going to blend well with my recipe. And then other shelves they could be looking at to bring in maybe a sprinkle of neuroscience or a sprinkle of attachment theory. And so then what they do is they take those ingredients, they blend together a recipe for the unique family sitting at the table.
I love it. And do people respond well to that? I would think so.
Yes, because in the teaching, what I do is I have up on the PowerPoint these images of a chef
Oh,
and a
yeah,
pantry
yeah.
and a family sitting at the table looking at the chef, thinking, what is the chef going to make for us? So it's multimodal in that way.
Yeah, it's very visual. I love it. Is there another story or metaphor that you find yourself gravitating towards besides this one?
I have so many. I
You
could
have
tell
so
you
many.
so many
You could
of them.
probably, have you written a book about it? And maybe I have missed it. No. No.
No, I just make things up.
I love it. I love it. I would love to hear more.
Oh, well, I could use our classic metaphors that we use in systemic therapy around the dance and explaining about how if we're coming from a first generation perspective, we are like a dance instructor. and we're helping the family to choreograph ways of being able to move more smoothly with one another, because that's right, that's right. Little snippets of metaphors I use all the time, because snowflakes turn into snowballs. And with that, I'm trying to promote in the training that small amounts of change leads to bigger change.
I love this so much. Oh my goodness. I'm taking notes while we're talking about this. Wow, I have not heard of this before. That's fascinating. I'm so excited about this. Are you thinking about writing a book or an article
You mentioned this
about
twice
metaphor?
now, so
Yeah.
maybe you're
Maybe
implanting it in my brain.
I'm maybe I'm speaking it to existence. Let's see if the universe will comply. Okay, I want to move us to the next question. You have emphasized in your clinical and supervisory work that systemic therapy is not about the number of people in the room, which I 100% agree with. And you have outlined key principles, context, circular causality, systemic alliance, even when working on one-on-one with clients. Can you tell me a little bit about how you translate these principles into interactive learning?
Yeah, absolutely. So one of the first things I focus on when teaching systemic thinking is busting the myth that family therapy is only for families. And as you pointed out, Sophia, that's your bread and butter of what you do in your teaching. And I'm sure the systemic educators listening, they're like, yes, that's right. That's what we have to do. So we know that it's about a way of thinking, how we understand problems developing, how they're maintained, and how they might be resolved within a relational and contextual framework. Now, for me, that is often the hardest shift for the practitioner in the room. And that's because in the Australian context, what happens here is predominantly people will be first trained in an individual model. And so whether that is psychology, speech language therapy, occupational therapy, psychiatry, mental health, nursing, and social work, even though that's not an individual model, but that's primarily in Australia, people's base training. And then they come across into systems thinking and systems training because it just makes sense. So the biggest shift I have to start with is helping people to move away from that individual focus, to take that helicopter ride up and to see the relational and contextual systems that their clients are a part of. So once that shifts and they're able to see that, then we're able to go from the zooming out perspective to zooming back in to then, okay, so how do you now apply all of that to just working with one person in the room? And
Mm.
so I have a blog on this, and people can access that from my website. It's called Family Therapy with Individuals. And I offer 6 guiding principles as a bit of a self-supervision check for people if they love to think and work systemically, but only ever have one person in the room. And so in that blog, it just asks people to reflect on, when you're working one-on-one, are you considering context? Are you viewing relationships as the client? Is that the focus? How are you holding a triadic focus? Are you thinking in circles, as well as asking your linear questions? Are you asking relational questions? And how do you monitor your systemic alliance? So those are the guiding principles. But in terms of those specific learning experiences, then I do think like genograms and relational timelines help to bring the broader system metaphorically into the room. So that's a great way of working systemically,
Yeah.
just one-on-one. When people really understand how to define problems in relational terms and then set relational goals, that helps them to keep the compass. The tracking sequences, great way of, again, being able to uncover patterns and the multiple players involved in patterns. Teaching circular questions and getting people to practice that in a role play just with one person. So they're learning how to bring in the multiple voices and views of other people into the room. We can set up empty chairs to represent important figures or people. The best tip I ever got from a colleague of mine, Roger Lowe, which then I use in all of my trainings as well, is just imagine that the rest of the family are sitting in the room. And that really puts a bit of a check on the therapist in terms of how do they respond? What's my
Yeah.
language? Who am I aligning with right now? Am I aligning really strongly with the individual narrative, or am I truly being mindful of my positioning and having an alliance with all people, even though they're not physically here?
Mm. I love this so much. Yeah, it does put your mind in perspective to consider like, am I leaning in too much? Am I perhaps getting caught up in this narrative right now, or do I need to step back and consider other family members and what would they think or what would they do with this information? Yeah, I love this, especially for teaching folks how to ask circular questions. There's so many different kinds of circular questions that we can ask. And so I love talking with my students about circular questions, and they probably have heard me way too many times talking about them, both in supervision and practicum and internship and all of the places. So yeah, I
Well, it's
love all of these.
that's a key systemic
Yeah,
skill. Yeah,
yeah,
fantastic. And then
yeah,
as well, because in your supervision that you do, because most people who are educators also provide supervision. And
yeah.
so it's a really great supervision question. So as a trainee is explaining case material and how they responded and what they did, then the supervisor could gently ask, would you have responded that same way if other people were in the room?
Yeah, yeah. Even with couples, I think that will be helpful. Even when let's say you're seeing one party in a one-on-one session, and then you later have a joint session. I think it does make a difference to consider, like, would this conversation change if that other person was in the room? Yeah, I love this
Yeah.
actually. Okay, so you have a wonderful systemic integrative practice masterclass, and you introduce a meta framework in this class for practitioners to adapt their interventions to each client's unique context. Can you tell us a little bit more about how you present this meta framework and what do you use to help your learners work with the uncertainty of having to adapt their interventions to the client's context? Because that requires
Yeah.
a lot of fine tuning on the spot, right?
Well, absolutely. That's exactly right. And so the masterclass that you're referring to, I introduced the meta framework, and that's a tool that I developed with a colleague. And that is actually published in the Australian and New Zealand Journal of Family Therapy. It's in the 2022 March edition. And that particular edition is freely accessible to read. And so any of the listeners who are interested, you can jump online and grab that. So the meta framework, it's not another model to memorize, it's a thinking guide. And so it helps practitioners to think flexibly and intentionally with regards to integrative practice. And like you said, like most practitioners who would attend like a master class, they already know the models. So they know structural, strategic, Bowen, narrative ideas, solution focused therapy ideas. The challenge for some, not all, but some seasoned practitioners is it's not about knowing more, but it's about figuring out how do I bring it all together in a way that feels purposeful and coherent. So
Mm.
some people might feel like, oh, I'm switching between models or I'm layering interventions without this clear rationale. And so the meta framework helps people to think that through more clearly. So just very briefly, the framework itself, if we could in our minds imagine a layered circular visual map, and there's 4 circles. And on the outer circle is way of being. And that helps therapists to reflect on who am I and how do I approach the work that I do.
Mm.
Then the next circle in the next layer is your systemic alliance and thinking about how you're building relationships and considering neuroscience as an alliance building tool as well to be able to create a sense of safety in the room. Then the next layer in gets people to think about their assessment that they do and their formulation. And the article talks about having a variety of assessment tools. So it doesn't just privilege one school, but having a wide variety of systemic questions to be able to generate lots of information
Mhm.
to then be able to think about what you think about with the family or the client. And then there's a decision-making process, and I'll talk a little bit more about that because I think you'll find it interesting. There's a decision-making process that then people go through to decide in that very inner circle what's going to be the intervention that I offer. And that's when I also use that metaphor of being a chef in a well-stocked kitchen. So what am I going to be pulling off the shelf and making for this unique family? And so in terms of that decision-making process, the practitioners walk through reflective questions. So they have to reflect on their own training. So what's their tool in their toolkit that they have access to? What are their strengths? What are their therapy preferences? And then what is the client's theory of change? Who's the most motivated person? What are the resources
Mm.
available to this family or organizationally that we can capitalize on to decide on the intervention? What are the constraints? What should be the timing of the intervention? And so in the training, we've got the visual aids, we've got the reflective questions. I give my own case study and I link how I think about a case and work through the layers. Then we do case consultation and people then bring their own clinical material. So it's, yeah, just helping people to organize their thinking about integrative practice.
I love this so much. Where have you presented this, Kate?
So what year are we in? 2025. So last year, 2024, my colleague and I, we presented this at the IFTA conference in Japan, the International
Oh,
Family
yeah.
Therapy,
Oh,
Congress. It was
fantastic.
wonderful. And we were invited. So we presented in by submitting an abstract, and then we were invited to present in the supervision stream and to be able to talk about this with other supervisors around the globe. So
Mm.
that's been really
Wow.
exciting.
What a treat. What a privilege for all the folks to witness this. I didn't get to go to the Japan one, so now I'm even more jealous that I missed it. But I honestly, I think if you haven't presented this in other venues globally outside of Australia, I think people are missing out that they haven't heard of this yet. So hopefully you'll get some keynote invitations after this podcast. And
Thanks, Sophia. And
yeah, because it sounds amazing. Mm.
that's the beauty of what you're doing is that you are, because we live in such a big world, but with like technology and podcasts, then we can all just connect globally as systemic educators and share our ideas more freely. So thank you to you because you're a part of being able to spread the word globally as well.
I know. I'm like a bee. Speaking of metaphors, I'm like a bee. I'm like cross-pollinating, going around, spreading the information, talking with people, chatting up, and yeah, just all around spreading the word. And also, hopefully, this is a form of informal mentorship for educators that are coming up and the next generation of educators. Really, that's my goal, so that they don't feel as unsupported or lost as I felt when I entered academia for the first time.
I
Okay,
love that.
so yeah, I want to talk next about your Working Safely with Families and Trauma workshop. This is my jam as well because I love trauma-informed care and trust-based relational intervention and some of these attachment-based perspectives. So in this approach and in this workshop, you weave mindfulness, EFT, attachment perspectives. Can you talk to us a little bit about what strategies you use when you teach this trauma-informed, neuroscience-informed approach?
Yeah, fantastic. Oh, and that's so good. I found someone else who this is their jam. I love that. So we'll have to find an international conference so we can catch up in person and talk
Yes,
about this
exactly. Yeah.
because I could talk about this for days. These are my two favorite topics in the world, systemic
Awesome.
practice and trauma-informed care. That's because we know trauma impacts the nervous system and the relational system, right? So it
Yeah,
just
yeah.
makes sense they go together. Okay, so where do I start? Back to my guiding principle of modeling the model. So when I teach this particular workshop, how to work safely with families and trauma, my number one objective is to make sure the learners don't feel overwhelmed by the content, because talking about trauma can be unsettling for people. So my number one goal is to help people in the room feel anchored and not flooded, but particularly because we know that the ACEs, Adverse Childhood Experiences Scale, we know that trauma is prevalent in society. And so the chances are that there'll be practitioners in the room where trauma is a sensitivity. And so I want to model the model, and I want to treat the training space like I would a therapy space. So we've already talked today about creating relational safety in the room, gifting people regulation tools that they can use throughout the 2-day workshop, promoting choice with engagement in the activities, because that's what we would do in terms of trauma-informed care with clients. I'm really mindful of the pacing of the day. So if we do a teaching section, then we have to do a regulation activity, and then we have a nice break where we go for morning tea and things like that. And so keeping people in their window of tolerance is really important. Now, here's another metaphor, since we're writing this book together now, is that I call myself a meerkat. Have you ever seen those animals?
No, I don't
Your
think
face is
so.
telling me no.
Yeah,
Okay, so you'll
yeah.
have to Google search this. So a meerkat, they're these little animals, and what they do is it's almost like they pop up and
Oh
they're
my God, they're so
scanning the
cute.
environment. Yes. So they're like scanning the environment, looking around. And so I joke around with the people in the room and I say, oh, look, everybody, I'm a meerkat. And my job is to be looking and observing and just checking in and just seeing how everyone's traveling with the content. And so I keep the training flexible. So if I see that this seems a bit heavy, then I'll actually break and pause from the content, and we'll just do a on the fly regulation activity, which is a teaching tool, because then people can go away and use it. And then when I feel like, yes, people are more regulated, then we'll go back into the teaching. Okay, but in terms of the actual training itself, the 2 days, the way that I see it is, and then day 2 is systemic therapy through a trauma lens. So day 1 is trauma-informed care with a systemic twist, all your key concepts that you would want to know to be a trauma-informed practitioner. So what happens in the brain? What happens in the body? What happens in relationships? What's happening with memory? And all of those things. But because we're giving it the systemic twist, then let's say that we're talking about polyvagal theory.
Mhm.
We're not just thinking about how that applies to the identified patient. We're thinking about the autonomic nervous systems of everyone in the room, or the family system, and even the nervous system of the therapist as well. And so we're taking all of those key concepts, and then we're just saying, hey, let's look at this relationally. And what would that look like? What does that mean? And so I'll teach the grounding tool. So like you mentioned, from emotional freedom technique. So that's the tapping, because when we help people to regulate, then we're regulating the individual, but we're also regulating the relational field. We're regulating the family in distress. And we know as well, if we're looking at tracking of sequences and trauma trigger cycles, that if one person can move out of distress and go into regulation, there's a beautiful knock-on effect then that can change a potentially anxiety-driven pattern. So on that day, I'm always getting the group to think, how does this technique or concept support safety in the system as well as the individual?
Mm.
How is it shifting relational patterns, etc.? And then day 2, we're jumping into the family therapy schools. So we are looking at those frameworks and thinking about how, using the lens of structural or strategic or narrative work, how that contributes to safety and stabilization of a family unit. Because, and if trauma-informed care is your jam, then where I use like the phased approach. Phase 1 is safety and stabilization. Phase 2 is then if the option is to do memory processing, and then there's integration into everyday life. And so from a structural family therapy point of view, trauma might disrupt the structure of the family and contribute to an inverted hierarchy. So then we have parents feeling hopeless and helpless. And then we have kids who are trying to be the most powerful people in the family because they want to have a sense of control. And then from a structural point of view, we'll talk about how do we shift that dynamic so that the parents are steering the ship again in the family system, and that the young people can go to them to feel contained. And that relates beautifully with safety and stabilization. If we do a strategic family therapy and tracking, we can be mapping those trauma trigger cycles and thinking about how to break those. And then from a narrative approach, we're talking about survival storylines instead of trauma content. And so that's how I keep the systemic thread running through everything. So it's not disconnected, but it's just a coherent way of thinking about this type of work from a systems
Yeah.
perspective.
Yeah, I know. It's like you're infusing our systemic approaches with all the trauma language and translating it for each
Yes.
model, which I love. I have not heard actually that kind of trauma informed. I have heard like culturally responsive structural therapy versions, but I have not heard the trauma informed version of it. So it makes a lot of sense. Like the two can marry together very well. It works. And it's all
Beautiful.
in the eye of the beholder, of course, because if you're not
Ah,
operating from
yes.
that standpoint, then it's not going to make sense, right?
Yes, yes, love that. And if anyone's interested, on my website, my colleague and I, we developed some guiding principles for working safely and systemically with trauma. And so people can have a look at that, see if it fits for them or not. I'll leave it up to
Yeah,
them.
I'm happy to link it in the show notes as well. And who is your colleague? Is this Dr. White?
Yes, that's right.
Oh my gosh. She might be my next Australian guest. I will try to
Fantastic.
to get her to talk to me, and maybe you'll do the introductions if you
Sure, I can do that.
Okay, awesome. Well, we have just a few minutes left. Time is flying by. But so yeah, I wanted to ask you about your systemic supervision groups, but also about the trainings you offer in schools. Do you have a preference? Maybe we can touch on one of these.
Okay, I do have a preference only because I knew that you were going to ask about supervision online, and I'm actually doing a really funky project at the moment that I'd love to share.
Yes, please.
Okay, so before we got online, you said that, oh, maybe I'll ask about your supervision online. How do you adapt it? So the project that I'm working on is really large scale. In 2024, there was a health and hospital district that I consult to that they wanted all of their 6 child and youth community teams to be trained in foundational systemic practice. And so that happened. And then this year, they wanted to scaffold the learning by providing a structured online systemic case consultation process. And I think, and I could be very wrong, so please, someone get in contact with me if I have this wrong. I think it could actually be a world first in its design. So I'm using a T team and O team model, so a treating team and observational team format. And because it's 6 teams, so we've got 50 plus practitioners
Wow.
during this 2-hour period. So one of the teams is nominated as a treating team, and then the 5 other teams are the observing teams. And each session, each month, they all rotate, so they all get a chance. But what we do on the online platform is we recreate a one-way mirror experience by coordinating screens going on and off at different moments across the process. So the treating team, they join on individual computers so that in true Anderson style, they don't have an opportunity to talk before they go into a reflecting team dialogue. And then the observation teams, they are all at their respective sites, but they're all sitting in one room all together so that when their screen is off and they're muted, they actually have the luxury of being able to talk and
Mhm.
hypothesize and hold that meta position. And so what I do is I interview the therapist, and it's just myself and them on screen, and everybody else is observing. Then their camera goes off. The treating team, their cameras come on. and they go into a reflecting team dialogue about what they heard in terms of some hypothesizing or some strengths they saw in the therapist or things they were noticing. And then their cameras go off. And then one by one, each of the other teams will come online. And I don't want to replicate another reflecting team dialogue. So they give one or two key messages about what stood out for them. And then their cameras go off. And then we circle back to the original therapist and we say, what stood out for you? So it's a really big process. There's lots of people involved, but it seems to be working well. So if anyone's interested, then please reach out and I can share more information about
I
that.
love this so much. There's so many possibilities for implementation with something like that. When you say you were interviewing the therapist, you're talking about holding like a mock supervision session. Is that what was happening? Like a consultation with
Yes.
another colleague? Okay. And so they were talking about maybe a case or a clinical challenge that they're facing, and you were processing through that with them, and that was your little mini supervision session.
That's right. So in live supervision formats, my interview is to gather enough clinical information about the case so that the reflecting team can reflect and then the O teams can send their message. So I'm not actually providing ideas or hypotheses. My job is to ask this enough systemic questions that it gives then the reflecting team and the observing teams content to be able to then have their reflections.
I love it. And so you said there are 50 people in attendance during this.
Yeah, well,
How
we
long
have,
is this
that's right.
supervision seminar?
So it's a 2 hour session
Wow.
and they meet once a month and it's a project for 1 year. And we could have 50 plus because we've got 6 teams that join online during that experience. So it's all scaffolded, it's all structured. They have their templates of what to do. In the observing teams, we have systemic leads who help facilitate the process. So yeah, I think it's really exciting.
Fantastic. And do they do any reflection post the seminar on their experience, or do you do a survey? Have you gotten any
Yes.
outcomes from them just yet, or not yet?
So at the end of the year, we'll do a survey, but also this particular hospital and health district, they're going to research this project and they're going to look at the effectiveness and they're going to look at clinician satisfaction and enhanced learning outcomes, etc. So we'll see what happens.
Oh my gosh, very exciting. Wow. I'm so glad you talked about this actually in this platform. I think it's going to inspire many more people. We have educators listening from different countries. A lot of them are in the United States, of course, but also Canada, UK, Greece, my home country, and many other countries all over. I think some 34 countries listeners of the podcast. So super exciting that you spoke about this, and I hope it takes off and scales up in a way that you never imagined. So, as we're wrapping up, I want to say a big thank you to my fantastic guest, Dr. Kate Owen, for sharing her experiences, her skills, her deep expertise with us, and for her amazing impact on the teaching and learning of systemic therapy globally. I hope her wisdom and experiences will help our fellow educators and listeners on their own academic career journey. Dr. Owen, how can listeners interested in your work reach out to you?
So my website is drkateowen.com and that's all my social media handles as well. So Dr. Kate Owen, yeah, stay in touch, reach out. And thank
Oh
you
my
so much,
God.
Sophia. I've loved the energy of this conversation and thank you for all the work you're doing.
Oh my gosh, thank you so much. To our listeners, I hope you found today's discussion enlightening and inspiring. I know I did. If you're hungry for more engaging conversations about teaching systemic therapy, be sure to follow our Learning and Teaching Systemic Therapy podcast episodes on Spotify, Apple Podcasts, Amazon Audible, YouTube, and wherever you find your podcasts. We have exciting episodes coming up every month, so stay tuned. Thank you for joining us today. This is Dr. Sofia Georgiadou signing off for today. Thank you.